alterations. See,
It is
maxillary
dangerous.
you do wherever you want, whatever, nothing is going to happen. Okay? Mandibular anterior, I told you. Now mandibular posterior. What is that? Inferior alveolar canal. Inferior alveolar canal if you damage. Neuropraxia, axonomatosis and neurotasis. Neuropraxia is you are not damaged. You are not damaged the canal. Suppose there is a canal here, okay, and this length was suppose 12 mm body, and you thought of placing some 11.5 mm implant, you can place no problem. But what happens is suppose you have placed an implant and here you thought threads are exposed and you are tightening it more. So that time what happens? You are exerting pressure on the canal border. Then that canal border, it's a trabecular bone, that can undergo microfracture. Then because of microfracture, there will be a blood collecting within that canal and it will cause ischemia and it can cause neuropraxia. Sensory disturbance for some period of time. But again it can regain. But this is happening why? Because you are not drilled. You are just pressing the implant. But suppose you have drilled. 12 mm you have drilled and placed 12 mm, no problem. You have drilled 12 mm and you want to put implant at 13 mm, then it can cause problem. You are compressing the bone above the canal. Or sometimes you are creating microfracture of that bone. Okay? And sometimes what happens? If the implant is touching directly with the canal border, this is metal, complete. Abutment is metal. So because of thermal conductivity, patient may get pain. So that's why they say like 1 mm, 2 mm away from the canal, safer distance. Okay? So neuropraxia, no need to worry. Within 3 to 4 weeks, it will become normal. This one, you are cutting the axons of the nerve. Okay? So, but still, the nerve can repair. See, the difference between this and nerve, completely cutting the nerve. And this is partial, only axons are damaged. You are drilling, and above all the canals, the border is thick, dense. Before perforating any visceral structure, you will get the sense there is some resistance. Before any perforation, there is a resistance. So you have neglected this resistance and you have got it dropped. If your mind is present at the time of implants, you can realize this. Yes, I have perforated. So suppose you got resistance and suddenly you got it drop. And you are not a fool now. After realizing the drop also again you are cutting. So after a drop, suddenly you will see that blood is oozing. Means you are, see again in the canal, first there will be artery, vein, then the nerve. So you are damaging first the blood vessel. Blood vessel is damaged, the blood is coming. You have not touched at the axons. Okay. So at that point you should limit your length. Okay. So even if the axon is damaged, again patient can get back. Okay. His sensations will come back. But nerve tissue is the slowest to repair. It's the slowest to repair. So it will take more time. And the worst part which can happen, and even here also we have never done, is you have realized the canal, you thought went, and again you went more deeper, again you continued with the next drills also. See, Lance drill, no problem. It may not cut the nerve into two halves. You have used all the drills, okay, and you have completely divided the nerve. Completely chopped. Distal lens, major lens, both separated. Still, this nerve reunion can happen and will happen. It will take 1 year, 1.5 years. But it can happen. It will not happen when you have cut and you have placed an implant in between the two nerves.
No scope.
No scope. Why say no? So, if at all it is damaged also, if you have realized, patient told there is a numbness or pain because it can be paresthesia, hyperesthesia or anything. If it is completely cut, it will be paresthesia. Okay? Patient is complete. Hyperesthesia or anything means nerve is still alive. It will come back to. Paresthesia means you have cut. But yes, patient is said paresthesia, take an X-ray. Yes, your implant is in the canal. Remove it within 15 days. Remove it and place a shorter implant. But you said, अरे कुछ नहीं, पेन रहेगा, थोड़ा सर्जरी, normal होगा. Then क्या होगा? Implant will integrate. Implant will also integrate now. Now you cannot remove the implant also. So if you place a shorter implant and allow it, then it can reunion and patient can gain. Many a time we have now around 3 to 4 patients here where patients are having numbness. That is not because of the what we have done is bypass. Many a times what happens is we do this mandibular jaw. पेशेंट को यहाँ तक टीथ रहता है and he wants replacement only in this region, and in this region because of the periodontal tooth loss and all, tooth arch will be like this and there will be a nerve very close to this. Only if you want to, he wants to extract this teeth, we can do Holland 4, but he doesn't want to extract this. इतना ही बिठा. Then if you take the cross section, nerve will be many a times in the 7th region, it will be more on the lingual side. As you go more posterior, it will be more lingual. Then we can place an implant which is like this. It's called as nerve bypass. यहाँ पे लगेगा implant, it will appear like this. Now I talked about that Samira Aisha, young lady, they have done same. But there we have actually now lateralization. This is bypass. Without touching the nerve, just placed in a tilted direction. But in some case, I have done the Lance drill and I told our fellow to follow the same path. Some slight angulation change and it is brushing this canal. Okay? So, patient has paresthesia. But, see, patients are not bothered about this. He has got teeth now, fine. यहाँ पे थोड़ा सा this area numbness है. How does it affect his daily living? It's just a sensory here. His motor nerves, everything are fine. And he is laughing. यहाँ पे numbness है. वो चलेगा. Patient is very happy. But whenever he comes, We discussed numbness, still paresthesia. We are worried more. Our staff, sir, still paresthesia is there. We are taking it as a complication and all. But if it is informed to the patient, if you want implants in this, numbness can happen. I will try my best to avoid this, but numbness can happen. So how does it affect? He happily says, sir, abhi hai. ऐसे 3-4 पेशेंट्स हैं, जिनका there is a numbness. So we think this is as a major threat to us for implantology, and I have an example here. So if there are chances of creating this, you explain it to the patient. In normal implantology, though you won't. But maybe suppose sometimes if you are doing a nerve bypass, when you will do nerve bypass when there is a compromised bone. When there is a compromised bone, explain it to the patient, this is the situation. And how does it affect? His tongue movements are fine, lip movement is fine, everything is fine. Nothing is good. We have a now patient of transient paralysis happened. That is more dangerous. Transient paralysis of facial nerve. We have not done anything. That girl, silly girl, she has given block. I don't know how she has given. We have treated lakhs of cases here, and after the block, patient has got. She went into the parotid band. कैसे? Even if I want to go also, how it will go? Huh? So she has ये ऐसे होता है. Huh? And she is saying, no, I am not confident in blocks. Huh? I said, Beta, means you are not confident in blocks, means RC you can do, yes, Mac. So for doing RC, you are going to call one more dentist to give LA. And then you are going to do the RCs. And that needle. And that maybe suppose if the injury happened or after that infection has happened, then damage. But here it is a problem, like facial nerve transient, right? Motor nerve. So his eyes are not closing whenever he is talking. That never happened with thousands of implants we have placed. Never happened, and with this LA. Never shocked. So obviously you are not going to do such blunders. You are now into practice, trained, everything. So this is not going to happen. Okay? And moreover, in implantology, you don't need blocks. Infiltration. You can do it infiltration. Okay? So that is what maximum can happen. And how does we are going to enter in parotid gland? Nothing. Nothing.